Hi, good evening, everyone. My name is Ivan Davila. I'm the Director of Communications and Community Engagement at Central Health. I want to welcome everyone. Thank you so much for joining us on a Monday evening. Si hay alguien que necesita de traducción al español, nos puede decir por favor ahora. Tendremos que tomar sus datos para llamarle por teléfono y traducir simultáneamente. Si alguien necesita traducción al español, favor de hacernos decir ahorita, salga de modo silencio y háganos saber ahorita, por favor. ¿No hay nadie que necesite traducción? Okay. In that case, we'll go ahead and get started. I was asking if people needed translation in Spanish so that we could accommodate for that. So again, my name is Ivan Davila, and we have a long agenda, a list of agenda items this evening. So we're going to go ahead and get started. In the last few years, we've kicked off our budget engagement process for the following year in mid to late April. Given COVID, we're kicking it off a few weeks later. But like in any other year, we at Central Health are committed to ensuring the public can join us throughout the entire process. And we'll talk about what that might look like this year later on this evening. I'm gonna go ahead and go through some virtual house rules. So everyone will be muted until about 6:10 or so when we open it up for questions. If you're joining us by video, please feel free to drop your questions in the chat box. We will answer them as we go along or during the Q&A time allotted. If you're joining us by phone, please hold your questions until we open it up for questions later on this evening. You can see the agenda on the screen, and for those who are on the phone, I'm going to go ahead and go through it. First and foremost, Mr. Mike Giesen, our President and CEO, will give an overview of the Central Health Enterprise. Then Monica Crowley, our Chief Strategy and Planning Officer and Senior Counsel, will talk to us about Central Health's strategic work plan and objectives. Then our priorities for fiscal year 2020, the one we're in right now, and the impact of COVID-19 on these priorities. After that, Ms. Lisa Owens, Deputy Chief Finance Officer, will share with us the financial impact of COVID-19 on the Central Health Enterprise. And then Ms. Crowley will come back to talk to us about the proposed fiscal year 2021 priorities. Then we'll talk about next steps in the budget engagement process for fiscal year 2021 before we open it up for questions. With this, I'm going to go ahead and introduce Mr. Mike Giesen, our President and CEO. Mike?
Thank you, Vaughn. Yes, thank you. And thank you all for joining us this evening on this virtual meeting to kick off our budget development season. The question, why this community conversation? You know, in light of COVID, this has presented us with some very unique and interesting economic challenges, but we think that this will give us some opportunities to really critically examine how we spend funds in order to be able to provide access to care. And so over the coming weeks and months, we'll have the opportunities for some very robust conversations. Another reason why we're having this conversation is we want you all to know what we know. And as you participate in this budget conversation, this budget development process, like I said, over the next several months, we think it's important to have access to knowledge so that you can form your own opinions and provide input and feedback as this process continues. So we have many more meetings in the months ahead, and this is only the beginning. So first, I'll start out talking about the Central Health Enterprise. What is the Central Health Enterprise, and how does Central Health fit in? As you all know, or many of you know, we're a healthcare district. We're created by statute, and we're governed by a 9-member board of managers. And we use property tax funds matched with federal funds to provide access to care. And currently, we fund access for almost 1 in 7 of every Travis County resident. And we are a critical part of the health equity equation. Central Health, as I mentioned, is part of an enterprise. We're one of 3 organizations. We're on the government side of the house. Like I mentioned, we're a healthcare district. But on the non-government side of the house, we have community care health centers, which is a federally qualified health center, one of the largest in Texas, and Sendero Health Plans Incorporated, which is a community-based HMO that provides health coverage. I'll explain more in a minute how community care and Sendero fit into the larger picture. But the main thing for now is just to understand that Central Health is one of 3 organizations in a much larger enterprise serving Travis County. Now, earlier I mentioned equity, And equity for the people that we serve, whether it's by race or ethnicity, gender identity, sexual orientation, neighborhood, or maybe a combination of all of those things, that people for generations have been set back by disproportionate impacts or discrimination. In terms of being able to provide health equity, we think it's important to focus on two things. One, how we pay for health care, and two, providing a full and robust healthcare system. These are the two pillars of equity: how we pay for health care and providing that full healthcare system. So keep this in mind as we move through tonight's program. Central Health mission is built on these two pillars: paying for health care and a full network of care. And our mission, by caring for those who need it most, Central Health ensures a healthy community. That's what drives us day in and day out. Now, how does this mission translate into a budget? Well, Central Health dedicates 96% of its budget to healthcare delivery. And that includes eligibility for healthcare programs, paying for healthcare across the full spectrum, whether it's primary care, specialty care, post-acute care, whenever you're discharged from the hospital, for instance. Now, I mentioned that 96% of our budget pays for healthcare delivery, but if you do the quick math, what that tells you is approximately 4% pays for the administrative or the government side of the house, so to speak. And so we run a very lean operation. So that's a quick look at Central Health as an enterprise and how that translates into our budget. But let's talk a little bit more about access to coverage and access to care. First, I'll touch on access to coverage. We have the medical access programs, and there are two: the Medical Access Program, or MAP, and MAP Basic. Now, Central Health screens Travis County residents for qualification in one of these two programs. And if you're an individual with income below 200% FPL, or in a household or a group below 200% of FPL, then we try to get you into either the MAP or MAP Basic programs. Now, the main difference between the two is that if your income is too high to qualify for the Medical Access or MAP program, then we try to qualify you for MAP Basic, which is a sliding fee scale program. Now, I mentioned Sendero Health Plans. This is another way that we provide access to coverage in addition to the Medical Access Program. So through capitalizing Sendero, but also providing premium assistance funds, we're able to help people get enrolled into Ideal Care, which is an Affordable Care Act plan. That is another way to pay for your health care. We have another way that we pay for health care, and that's through administering federal matching programs, whether it's on the Medicaid waiver programs that to try to provide new and innovative ways to provide care, or through providing hospital funding. So to conclude, you have the medical access programs, you have Sendero, and you have direct pay or federal matching programs that pay for the full spectrum of care. Now, the question is, okay, we understand how you pay for care, but how do people access that care? Where do people go to receive care? And as I mentioned earlier, we have enterprise partners, Community Care and Sendero Health Plans. Community Care operates over 26 sites and has a mobile team, has street medicine programs, walk-in clinics. They've made house calls. They recently really increased their telemedicine offerings. They have pharmaceutical, and they provide care to over 80% of our funded patients. Sendero, like other health plans, has a network, but in many cases it's better than national companies. And its network looks a lot like other health insurance networks where you have hospitals and primary care providers. So those are two of the ways that we provide access to care, but that's not all. Central Health has a number of partnerships with other healthcare providers: People's Community Clinic, Lone Star Circle of Care, Planned Parenthood, Integral Care for Mental and Behavioral Health, and Acute Inpatient Psychiatric Health are all ways that we help provide access to health care. Additionally, we have partnerships with the major hospital systems, Ascension Seton. We also have partnerships with Dell Medical School. We work with St. David's hospitals and dozens of other urgent and specialty care providers and post-acute care providers. So think after you've been discharged from the hospital, to really round out that system of care that we provide for individuals. So now that we have an understanding of how we cover or pay for care and how we provide access to care, let's look at how this translates into some numbers. So on your screen, you'll see an excerpt from our annual report. And it provides information on the left-hand side about the number of people that we're privileged to care for. So 147,000 patients served. This is more than 5,800 than the previous year. And this is important because, again, like I said earlier, we're able to serve 1 in every 7 Travis County residents. And we are privileged to serve each and every one of these persons across the full spectrum of care. And as you can see, we have the network that I spoke of earlier, over 183 provider locations. And there on the right side, you can see some of the service expansion efforts that community care has provided over the course of the last year. So that's a little bit about the Central Health Enterprise, how we pay for care, how people access care, but it also gives you a sense about the numbers that we serve. And I will say, you know, we talk a lot of statistics and numbers and healthcare jargon, but it's important to note that people are not just patients. We might use that term from time to time, but there are people with backgrounds and stories and experiences that we consider it a true privilege and honor to serve. So we'll talk more about this as we go through the budget process. But at this time, I'd like to hand it over to Monica Crowley, our Chief Strategy Officer and Senior Counsel.
I think I'm unmuted now. Thank you. And tonight I am going to present on our fiscal year 2020 priorities. And as Yvonne said at the beginning, this is usually a conversation we begin having in March and April, but with COVID-19, this is something that we're starting today. And I'm going to start this looking at our board-defined objectives. The Central Health Board has provided guidance to Mr. Giesland, our CEO, and us operating as staff through its fiscal year 2019 through fiscal year 2024 strategic plan and through its annual board adopted strategic priorities, which were adopted through the fiscal year 2020 budget resolution. Our board-defined objectives include developing and executing a healthcare delivery strategy based upon people and place, implementing a patient-focused and coordinated healthcare system, and implementing a sustainable financial model for healthcare delivery strategies through fiscal year 2024. On the next slide, we have our fiscal year 2020 budget resolution priorities. And Mr. Giesland gave a little bit of an update on some of the work that we've done already in fiscal year 2020, working to improve our infrastructure, including an Eastern Travis County expansion focused on the priority areas of Colony Park, Hornsby's Bend and Austin's Colony, and Southeast Travis County, and on our technology enhancements, including the Epic electronic health record upgrade that we're going through with community care, the Central Health Premium Assistance Program expansion, in which we've enrolled over 500 medical access program members in a Sendero Health Plan's Affordable Care Act off-exchange marketplace-based health plan. Mr. Giesland went over some of the work that we're doing in improving access to care and access to coverage. These include changing the eligibility period to the medical access program from 6 months to 12 months. We have presented to the Central Health Board and have done preliminary analysis and presented to the Central Health Board on that expansion and are waiting for approval from our other partner in the Community Care Collaborative, Ascension, Texas, to continue and complete that work, and on other primary and specialty care enhancements that are underway. We're continuing to work on sustainable long-term funding models and sustainable financial reserves. and on the Brackenridge campus redevelopment. And if anyone has been, or I guess before we were staying at home and working at home and staying safe, demolition has commenced on the Brackenridge redevelopment. If we look to the next slide, the impact of COVID-19. COVID-19 has had an impact not just on the timeline for how we go about developing our priorities, but COVID-19 will have an impact actually on what our priorities that we're proposing for fiscal year 2021 are. Today, Central Health, Community Care, our partners at the city and at Travis County and at Dell Medical School and our other critical healthcare delivery partners are focused on primarily addressing COVID-19 related needs in the immediate term. Central Health was able to shift its focus to support our partners as they transition to new modes of care such as telemedicine or an increased focus on screening and testing to address both the COVID-19 related needs and ongoing healthcare needs of the people that we're privileged to serve. This also, like I said, has impacted our work towards our current fiscal year 2020 budget resolution. We've made meaningful progress, like Mr. Giesland described before, but we haven't made as much progress on the current fiscal year 2020 budget resolution priorities as we would like. And we are all aware that the COVID-19 impact is going to continue not just throughout the end of this fiscal year, but it will continue into the next fiscal year. We're uncertain not just how much the impact will be or for how long it will be, but there's also uncertainty around what both the short-term and the long-term economic impact of COVID-19 are going to be. And what that's resulted in is in a shortened process for developing our fiscal year 2021 budget priorities, and it's resulted in a slimmer list of what could be transitional operational fiscal year 2021 proposed priorities that includes continuing priority work from fiscal year 2021 and a proposal around taking on a systems-based planning approach in support of the ongoing board-defined strategic plan objectives. And we will talk more about that in a few minutes, but now I'm going to hand it off to Lisa Owens, Central Health Deputy Chief Financial Officer.
Thank you, Monica. Can you hear me okay, Yvonne? Okay, great. Well, thank you everyone for joining us. I'm Lisa Owens, the Deputy Chief Financial Officer. I'm going to walk through a couple slides that we shared with our board a couple weeks ago with some information about the funding that is coming into the community to assist with COVID-19. In addition, the impact in the current year. We are in what we refer to as fiscal year 2020, which ends in September of this year, and then our planning for next year, which we refer to as fiscal year 2021. So our first slide just shows an overview of some of the funding that had come into the community. And one thing I'd just like to preface all of this with is things are changing rapidly as we learn more, and the funding is changing rapidly, which is great as we're being as responsive as we can to providing the funds that are needed. But initially, the city and the county did receive infusions through the Coronavirus Relief Fund. And in the healthcare system, our hospitals have been allocated initial funding through the CARES Act. These are federal sources of funds. And that CARES Act did have about $100 billion for hospitals. The initial infusion was approximately $30 billion. And it was distributed to the hospitals throughout the country based on what is referred to as a Medicaid fee-for-service rate. And our estimates that looking at Travis County hospitals could have received approximately $33 million. So since this presentation was provided to our board, there have been additional allocations through the CARES Act. Recently, there was another $20 billion infusion to hospitals, and that remaining $50 billion will then go to counties that have high COVID rates, rural hospitals, clinics, and Indian Health Service facilities, and then, of course, testing and reimbursements for uninsured. In addition, one of the ways that the federal dollars are brought back into our community that we refer to frequently is called intergovernmental transfers, and that's a matching process where local tax dollars are matched to federal dollars. And what is referred to as the Federal Medical Assistance Percentage, FMAP, was enhanced, and that percentage was increased by 6.2%. And this FMAP is the percentage rate that is used to determine the matching fund ratio. So by increasing that rate, it requires less local funds to bring into the community the same amount of federal dollars. So it does reduce the local impact. There were also in two major programs that impact Travis County through CMS, two major programs, disproportionate share and uncompensated care are two programs that we participate in this county, in the area and in the state. And the disproportionate share program, which is referred to as DISH, did have $8 billion of cuts planned to it. And these are significant numbers because those are for the whole program. But those $4 billion per year for each year was eliminated. So those cuts will not take place. So those funds will stay at their levels that were intended before the planned cuts. So rolling back some of the planned actions has maintained funding levels. Also, there's enhanced Medicaid program payment rates, paying Medicare rates to hospitals for the uninsured, and then other legislation allocating additional $75 billion to hospitals, but also accelerating payments. And what this means locally for us, we've seen it already. As I mentioned, we use federal matching programs that require intergovernmental transfers, which are local dollars that are matched by federal dollars. And the dates are being moved up on those, which means the money is being available to the communities earlier in the calendar year. For community health centers, which community care clinics and other clinics in the community, such as People's and Lone Star Community Clinic or community health centers, they are governed by, or they receive federal dollars from a federal agency referred to as HRSA. And there was $100 million of funding initially allocated to the hospitals. To the clinic systems, community health centers. In addition, we also recently heard of another allocation of that, and we estimate that, we know that community care received approximately $3.7 million initially, and we recently heard of another expansion for capacity for coronavirus testing of over $1.8 million. Again, local community health centers such as Lone Star and People's would also receive funds through those programs, and those would be coming from HRSA. Looking at Central Health, we have submitted an application to FEMA for public assistance. It's in the very early stages of the disaster program for public assistance. So we will be gathering eligible expenses as it relates to COVID-19 and request reimbursement through that FEMA application process for public assistance. Looking into this year, 2020, on the next slide, if we can go forward, I want to hit highlights from our current year where we think we could see a financial impact. I think as Monica discussed, there's a 100% focus on making sure that we meet the clinical needs in this community to the COVID requirements, whether it's personal protective gear or systems in place or communication tools. And so that has been a main focus and will continue to be a main focus as we move forward. In Central Health, our primary revenue source, about 92%, is property taxes. And those property taxes were due January 31st in this fiscal year. So as of March and even into April, we have a strong cash position. We've already collected 99% of our tax revenue, which was budgeted at over $214 million. And we are in a strong cash position as we move forward as a result, and also have strong reserves for healthcare reserves and primary care. Going into our clinic system at community care, this is where we are seeing an impact. If you've been able to join us at any of our presentations from our clinical partners, you will have seen that the impact is seen in the encounter level. So where our clinics were hoping to see approximately 2,000 encounters per day. That is at about 75%. So that is at about, 70%, just under 1,500 per day. And what's really been wonderful about the 70% rate is that we have pivoted quickly and successfully to telehealth for our primary care services. And so it has been a great success that we were able to quickly lift up telehealth services for primary care and make that transfer. However, things like dental service were put on hold because they could not be implemented via telehealth. And so those were put on hold and will be brought back online. We'll be resuming soon. Community care is also a performing provider in a program, another federal matching program, referred to as the Delivery System Reform Incentive Payments, DSRIP. And I'm going to talk a little bit about that throughout the organizations as it impacts several of our partners. And that program is a program through CMS that pays for transforming the system to pay for outcomes as opposed to paying maybe fee for service or a traditional payment method. It's about changing how we pay for care, paying for health outcomes. And as a result, community care may not be able to achieve, they have traditionally had high performance in this area and achieved very high numbers in their outcome measures. But when some of those measures would be around blood pressure or primary care settings or even dental visits, there would be concern about the DSRIP program, as we are, again, as I mentioned, very focused on COVID, and the telehealth prohibits some of those services from being delivered. So we are closely monitoring that with our partners. At Sendero Health Plans, which is our health plan, it's our understanding they were the first community plan that waived COVID costs for members in the area. And earlier reports were that they had a very low number of cases of their 13,000 members. Sendero is using a third party to help with analysis and determine the risk in this area. And they did decide to reserve $2 million per quarter for potential COVID costs going into the next year. So that is happening. And then in the Community Care Collaborative, as I mentioned earlier, the Community Care Collaborative just has receives the DSRIP revenue from the state, and they are paid annually for their performance period. So the current year, in the current fiscal year that we're in right now, that payment is anticipated later this summer. And that is being paid for calendar year 2019. So there is low risk there. So we don't foresee an impact in this current year. And we're currently estimating to be well over budget at a high percentage of total outcomes being met last calendar year, 2019, before COVID. So now looking into the future, we are very focused on trying to make sure that we plan conservatively and take into account the knowns, but also the unknowns. And so as we look at FY21, fiscal year 21, going forward, just a few things. Central Health, we look at our property tax projections over the long term. And so, Anice, if you wouldn't mind going to the next slide. We look at we'll do a 5-year forecast. Oh, I'm sorry, must have missed one. We do look at a 5-year forecast. So I think this is just mislabeled. Apologies. This is our looking forward at 2021. This is the right slide. We will be presenting that to our board May 27th, and we'll look at a long-term look at and primarily our revenue source being tax revenue. We will be modeling and taking into consideration what we think could happen. Obviously, there will be long-term implications, but looking at the property tax over the long term will be how we will approach that with our board. We also are uncertain about hospital risk. We currently are in negotiations with our hospital partner, and the hospital payment model may change going forward, which could change the risk. And then on an enterprise level, there could be multiple waves. And so this kind of leads into our clinical partners. We do think there could be multiple waves of impact as the rates go up and down over the next several months. There are many unknowns, as I'm sure everyone on this call is aware. Things are changing rapidly and daily, and we're keeping in touch with that, but trying to plan for multiple waves and possibly a second wave this summer. But it would mean delays in returning to our pre-COVID service levels and things like an additional need for PPE or service lines that may be having to be put on hold or stop and start throughout any sense of multiple waves or a second wave. As I mentioned earlier, the DSRIP program, which is our matching program that pays for outcomes, in the current year, health outcomes may be limited, and so the same issue would arise again in FY21 potentially, so we'll be monitoring that as well. And then Monica mentioned one of our priorities, organizational priorities as an enterprise, was supporting the transition to a new electronic health record, and we continue that work. It is still a focus of both of our organizations and working together. And we will be just monitoring that risk as we go forward. In Sendero Health Plans, they are, as I mentioned, using a third party, but there is the risk that the costs of COVID patients could be slightly more than anticipated. And then on the longer term, the Sendero Health Plans risk adjustment process could also impact their cash flow. So we will be working closely with them. There is timing differences on how the risk adjustment is calculated for health plans, and that timing is that very similar to other programs, the end of the calendar year, but the payment that may not be received until later in the summer. And so Central Health would be working with Sendero to support cash flow if that were to arise. And then finally, for the Community Care Collaborative, going into next year as the performance year in fiscal year 2021 is looking at calendar year 2020, which is where we are right now. We do anticipate an impact to that. There are a lot of terms used in this program. Category C, Category B are mentioned here on your slide. We generally have very high performance in these areas. However, as I mentioned, some of the outcomes that are measured, such as in a dental setting or a blood pressure check that couldn't be done in a telehealth environment, those are at risk, and it is about potentially $26 million. And then in the Category B area, the patient volumes are driving that, and that could be at risk there as well. So these are risks we are monitoring closely, and we are taking them into consideration in our planning. And we are working closely with all of our partners in the enterprise as well as in the community to ensure that we're keeping track of the risks, the funding coming into the community, and making sure that we're supporting each other. I will say I'd like to ask all of you to please monitor our website. We do kick off our budget process May 27th at our board meeting. We will present the long-term look, a 5-year forecast. And with that, we launch on our finance webpage. We will have a web page dedicated to the budget process like we do every year. And we also will be posting our presentation. So we hope you'll follow along throughout the summer. And I think Yvonne will fill you in later about the calendar. So I'm going to turn it back over to Monica, who's going to talk a little bit more about strategic priorities. Thank you.
So these, as we said, this has been a tightened schedule, and the Central Health Board only received its first brief presentation on these proposed priorities last week. And this is, like everyone has said, is the start of an ongoing conversation where we're seeking input and feedback on these proposed priority categories. But the below categories are the proposed fiscal year 2021 priority categories. And I'm going to go into a little bit of detail on some work that could be included in these priorities. But I think you also, Yvonne is just putting up a link that has in writing if anybody wants to read along or review later some more detail about the types of work that could be under these categories. Improving access to care is the first priority category, and this aligns with objectives, all three of the strategic plan objectives. And the work in this area includes the Eastern Travis County priorities, and immediate work is underway as we're planning facilities in Colony Park and in southeastern Travis County based on identified gaps in care and on community input. And this work is continued priority work that's proposed for fiscal year 2021, as well as continued planning around the Austin's Colony and Hornsby Bend area. Also in this access to care area is the systems-based planning proposal, which will build on our ongoing access to care work group that involves Central Health, Community Care, and Sendero Health Plans, working to identify gaps and health disparities, and to take an approach to address these disparities and gaps across the system, from preventive and primary care all the way through acute hospital and specialty care, into, as Mr. Giesland mentioned before, post-acute care and through to palliative care, and developing system-wide plans to address these gaps that are both developing long-range plans while prioritizing high-need areas and service lines that we would address in the immediate term in fiscal year 2021. Another one is the ongoing COVID-19 response, and this aligns with objectives 1 and 2 of the strategic plan. And this includes both clinical priorities, including ongoing and additional testing capacity, and transitions to telemedicine that could be needed at community care and with other contracted providers like Lone Star Circle of Care and People's Community Clinic. It includes ongoing communications work, continuing both to support the expansion of education and outreach, informing people how to protect yourself from COVID-19, and implementing new work focusing on education regarding chronic conditions that are in healthcare disparity areas that can exacerbate the illness for the populations that we collectively serve across the enterprise, and support ongoing support of public health functions, such as continuing to support contact tracing and exploring potentially expanding adult immunization services. These categories include enhancing clinical programming and supporting transformational operational initiatives, such as supporting the completion of Community Care's electronic health record transition to Epic, working with provider partners to develop plans to continue appropriately using telemedicine virtual care, and e-consults for primary behavioral and specialty care, streamlining our eligibility and enrollment processes, and standing up more virtual enrollment options, and then strengthening our medical management and case management supports, and developing home health solutions as appropriate. The other two, the final two proposed fiscal year 2021 priority categories include implementing a hospital funding model that we are continuing to work with consultants to ensure that we are prepared to adopt additional responsibilities, and continuing to establish financial transparency regarding funded services and associated costs. And these are important work, whether this is important ongoing work for next year, regardless of whether we are in a new funding model or whether we're continuing in our current structure. This improved transparency and improved operations on the central health side are important in either way. And then finally, last but not least, continuing the redevelopment of the Brackenridge campus. And we're awaiting final zoning from the Austin City Council, but we'll continue negotiations and work around the realignment of Red River and the demolition of the tower.
Thank you, Monica. All right, so Anais, the next slide, please. So this is what the budget engagement timeline looks like for next fiscal year. And so we essentially launched the budget engagement process today, right now, through this community conversation. And it's going to be ongoing through throughout the summer, as you see on the screen. We are going to be sharing an online survey with everyone who participated and our entire list of stakeholders. And it'll be on these strategic priorities that Monica mentioned for fiscal year 21. And it'll be an online survey that we will be promoting throughout social media networks. And then we will also be holding phone interviews. We will be interviewing our MAP and MAP Basic members by phone, and just to make sure that we are touching base with our consumers, with our direct consumers, and that'll be ongoing through June 21st. And then we're going to be producing a report that then Monica and Lisa and team can use as they continue develop the budget development process. Monica will be sharing or giving an update on the strategic priorities to the strategic planning committee of the board in July, and that's when the budget engagement report will be shared. And then we're holding a community conversation to discuss the proposed fiscal year 2021 budget in August, and it'll be late August, as indicated on the screen. And then last but not least, we'll hold public hearings September 9th and 16th. And this will be the opportunities to come in and share thoughts and comments with the board. As usual, we welcome thoughts and feedback via the online survey and via these community conversations and via email. We always welcome community input via email and continued dialogue throughout this process. We prefer to have continued dialogue before the public hearings, and of course, then we invite the public to attend the public hearing September 9th and the 16th. And now I'm going to turn it over to Ted Burton, our Vice President of Communications, who will be moderating our Q&A session. Ted?
Hi, can you hear me now? Okay, great. I had to unmute. We have several questions in our chat, so we'll go through some of those. And then, of course, we'll take your questions as we move forward. I won't necessarily take these in order. There is a question about why is so much being spent on the redevelopment of our downtown property. And I think it'd be helpful to clarify when we talk about redeveloping the Brackenridge campus, the purpose of that redevelopment and how, where that funding is going to go. And Mike, do you want to help explain that?
Sure, I'll start out and others please chime in. But whenever you look at developing a tract the size of the old Brackenridge tract, which is 14 acres, you have certain expenditures that go into that. And it's not only, for example, demolition of the buildings that are there. There's a lot of consulting, a lot of engineering, a lot of site feasibility work, and the list goes on. But also bringing on board developers. You need to have a good RFP process or a procurement process where you request proposals for the development of the tracts or the parcels of property on that tract. And there's some cost inputs, just like any business endeavor. But as Ted was pointing out, on the other side of that, you have significant return, and that's one of our key long-term financial strategies, which is to use the funds from the Brackenridge campus development as they come in over time to be able to fund healthcare in Travis County. It's the expansion projects in East Travis County. It's the service expansion, whether it's by a line of care such as women's health care or cancer or primary care or post-acute care. So the Brackenridge campus is an important part of funding care long term. But in order to get there, you do have some front-end costs associated with making that development part of the financial strategy for funding healthcare.
And just to emphasize again, though, the money from the redevelopment of the property is going to go to fund future healthcare delivery.
Yes.
I'm going to go back to the top of the chat box with a couple of questions. One, I think, Monica, this would be for you regarding the payment model. And you did touch on it, that this payment model is currently in negotiations regarding how we pay for hospital care. And therefore, you're not at liberty to discuss it at great length. But you did mention that this change in the model would result in greater transparency. Can you talk a little bit about that?
Well, and the reason that we're in negotiations is because we are moving towards greater transparency, greater ability to track how the funding that we use to purchase hospital and some specialty care it is used, and that is the goal of the negotiations that we are in primarily with our hospital partner. And currently, our funding model is we have an agreement with Seton, which is Ascension, Texas, to provide the bulk of our hospital care, and much of the way that is funded is through leveraging federal funds, and we want to continue to leverage the federal funds that we can. Lisa had mentioned this through the DSRIP project and other projects that other programs that bring funding for safety net services to our community. And we also want to encourage improved transparency of reporting and sharing of data. And so one of the ways that we're looking at that is through adding some more claim style tracking and payments to the way that we are the way that we are tracking services, but this is up in the air, and we are currently in negotiations, and so we can't go into a lot of detail about what these models would look like now, but we are continually working with the board and updating the board on where we are. But the goal of these conversations is so that we will have greater transparency and reporting on our hospital-based services and some of the specialty-based services.
And thank you. And Lisa, you mentioned during your portion of the presentation about federal funding and changes as a result of this COVID pandemic. And one of the things you did talk about was the matching fund rate, that less local funds will be required to bring down the same amount of federal dollars. Can you re-explain that for our participants?
Sure. So we participate in a program, and the formulas are prescribed by Health and Human Services Commission here in Texas. But the ratio of local dollars to federal dollars is published and put out there every year. And by increasing that percentage rate, it improves the ratio, and less local dollars will be needed. And so that is a positive for the local community.
And I guess, is that also one of the uncertainties moving forward, is that even the presentation that your team presented a couple of weeks ago, there's already been a change in how much money might be available through the federal government, whether it's FEMA funds or CARES Act funds. So that could be changing moving forward as well, correct?
It's changing every day, I think. And yeah. I think as the longer things go on, I think the general concern is that we want to protect the healthcare system as much as we can. And so we are monitoring that closely. The funds, those are large amounts of dollars from a federal perspective, as you saw in the charts, and those are being distributed incrementally, and we're keeping up with that. A lot of it impacts the system that we refer to, the healthcare system, and we're one part of that. But we are keeping up with that, and again, that's why I would say I hope everyone will keep up with this throughout the budget process, because we'll report out to the board in the planning and the budgeting process what we think we know at the time, and try to keep up with the reporting out so that we can match our plans to what we know at that time.
Ted, if I may add to that.
Go ahead, Mike.
I want to thank this board and also prior boards in the finance team for really working diligently over the years, for the past several years, to make sure that we have reserves set up. And we're about to head into a time when I think we'll look back on this long-standing practice. It's part of our bylaws, even to point to the wisdom of maintaining those reserves as we go through the next few years.
I wanted to follow up on a couple more questions that were in our chat. So one of our advisory committee members, and Monica, you did touch on this, but I think it's worth re-emphasizing regarding what financial impact this could have on service expansion in Eastern Travis County. And I think you mentioned under the 2021 priority categories that service expansion will continue, but some things may have been paused or slowed down because of the pandemic. Do you mind reiterating that?
Yes, I think that there is work that we had that was ongoing in fiscal year 2020 that has been prior work in fiscal year 20, or that has been priority work of fiscal year 2020, like some of the planning in Eastern Travis County, some of the property acquisition work moving forward, that because of the work from home, work safe, social distancing efforts, and then also just this focus that we've had to really up until just the past few weeks, really focus on pivoting to try to address immediate screening and testing and transition to telemedicine needs, so that we end up planning for alternative care sites, just a lot of work building up our capacity to assist in contact tracing efforts. There's been a lot of work that would have happened in the past couple of months around some of these priority areas, like the long-term site in Eastern Travis County that would have taken place that we are intending to take place continuing now and then into fiscal year 2021. So some things are going to continue. They haven't gone as quickly as they would have if it hadn't have been for the COVID-19 pandemic.
Thank you. We have somebody, a caller with their hand up, and before we, well, let's go ahead and take that call if we can. Somebody has a question on the phone. Yvonne, are they still there?
Ted, the person with their hand up on the phone, if you don't mind unmuting, well, actually, I can unmute you. Okay, you're unmuted. Can you go ahead and, can you speak now?
If you're on the phone, can you ask your question?
Who are you trying to reach?
It may be you, or did you have a question? So, Yvonne, can you still hear me?
Ma'am, did you have a question for us? I guess not, Ted. Go ahead.
Okay. Am I muted, or can you hear me?
We can hear you.
Okay. There was another question regarding just shifting priorities, considering the current reality. And I think one thing that you talked about, Monica and others, that has been that has happened as a result of the pandemic, as some of these new models of care got a real kickstart because of necessity. And Monica, you touched on a couple of these, but they were already in the works and already happening. But in response to a pandemic, we had to move it even more quickly. And I can see that continuing. But will you touch on a few of those? You mentioned telemedicine, or really right now it's telephonic medicine, but will become also video or telemedicine as well in the not too distant future. But also our ability to screen and enroll people in the medical access program without having to have person-to-person interaction.
Yes, yeah, there are things that we've been working on also, like e-consults from provider to provider, in addition to the telehealth and telemedicine that we've been working towards, that have been, I guess, as across the whole industry, but also for the people that we serve, has been really set up. And we're going to be bringing back to the Strategic Planning Committee next month a survey that we've done around the telehealth services that have been provided. And just as a preview of that, it seems like almost across the board, people have really appreciated the convenience and the ability to get seen, or I guess heard, so quickly by a provider, and be able to talk to their doctor on the phone during this time period. And one of the things that we've heard from the provider partners that we work with is that this COVID-19 pandemic is going to it's going to change forever the way that healthcare is delivered. And so some of these things that add, convenience, interactivity, like Ted said before, more virtual care and being able to monitor people's health in their homes. One of the things that we've also done has been able to provide blood pressure cuffs to women who are pregnant and may be experiencing high blood pressure or hypertension during their pregnancy, so that they can have their blood pressure monitored from home, so that they don't have to come into the office as much, and risk being exposed to COVID-19 by being out in public, and they're able to learn how to take their blood pressure and have conversations with their providers and nurse practitioners, so that they're able to be tracked and monitored as well. And this is something that I think I see we are going to be looking at. How can we appropriately use these tools and the lessons that we've learned from this pandemic to increase access to care more quickly than we otherwise would have been using some of the more traditional modes of care.
Right.
And like Ted said, the eligibility and enrollment piece, streamlining these processes so that people don't always have to come in and have a face-to-face visit or bring in paper documents, but can submit documents electronically, is something that makes people being approved for the medical access program quicker and easier and more convenient for them.
And you know, the
Mike,
good thing about telehealth too, Ted, Monica, is that it fits the individual's technology. And so even if you don't have access to the internet, because there's a huge digital divide out there, if you can get to a telephone, then not only can we connect you with enrollment, but we can also connect you with outreach and education. We can connect you with providers, all via telephone. And so it's the full spectrum of the whole care experience that we can connect people with. And I think this gives us some unique opportunities to bridge some divides that have been out there for way too long.
We had another question just regarding service expansion in Eastern Travis County and noting the latest COVID-19 data. And I think this might be an opportunity to talk about two things. One is, Lisa, in your presentation, you talked about federal funding, and some of that funding can go to outreach and community engagement around COVID-19. I think everybody on this call is aware of the latest data that was shared by Community Care regarding positivity rates among the Latinx community. And so that is an emphasis for Central Health, is outreach and engagement to this specific population. And we've been doing outreach and paid media around this, and are beginning another phase on Wednesday, specifically towards targeting the Latina community, also targeting low-wage workers who are going to work because they have no other choice, but then maybe coming home to multi-generational households. And so talking about how to protect themselves and protect their families. So I guess I want to acknowledge the question, which is, yes, we are paying attention to the COVID data, but also maybe give even Yvonne or Mike or someone else a chance to talk about, in response to that, how we're changing and shifting our outreach and engagement strategies as a result.
So Commissioner, can you hear me?
We can hear you.
Commissioner, this is Gloria Liel on behalf of LULAC Council 64. I submitted
How are you?
I'm fine, sir. Thank you. I submitted that question because the three groups that have been identified are construction workers, nursing home workers, and the family units that these categories go to, which
Correct.
are uninsured, sometimes undocumented, and they certainly do not have access to the internet services. So what can we do to reach these three groups that have already been identified? Thank you, sir.
You bet. And I'll
Thank you.
start off. Great to hear from you. I'll start off with that answer, but I'll ask Yvonne and others to chime in, please. One, I think it's important to recognize that there are hard to reach populations, and so through using community healthcare workers, direct mail, to the extent that we can get addresses, but more importantly, targeting that direct mail in zip codes that are at risk. And then on the media, really reaching out to culturally appropriate media, radio stations, for instance, Univision and others, to make sure that we're connecting with people in all different ways, shapes, and form possible. I mentioned community healthcare workers, and we also have other staff that are doing direct outreach as well. And so it's not just about what you put on digital media or airwave media, but also just trying to make those one-on-one personal connections with people. That's absolutely going to be critical. And we're going to need to be able to sustain this for the next several months. And that's going to be important.
Mike, we are working very closely with Community Care on exactly what you're talking about, and Yvonne can weigh in as well. But we realize there are people who do not have internet access, and so our community outreach specialists are making phone calls to MAP patients, many of them who don't speak English, have fear of immigration issues, but calling them and trying to educate them about where to get tested, how to get tested, who should get tested, and how to protect themselves and their families. And we aren't there yet. We have much more work to do, but we have to work in partnership with Austin Public Health, Community Care, and other local organizations that we can lean on each other to help get the information out. And you're exactly right about the target audiences that we must reach. Yvonne, did you want to weigh in?
Sure, Ted, thank you. So definitely having conversations with immigrant serving organizations, including the Mexican Consulate and many others. We're in communication with the Immigrant Services Network of Austin. Our community outreach supervisor who's here on the call attended last Friday to share information about testing and how to protect yourself from COVID, et cetera. And then we're also having conversations, in addition to what Ted is saying, in terms of teaming up with Austin Public Health and teaming up with Community Care and so on and so forth. We're also having conversations about how can we do outreach as some small businesses start to open back up. How can we connect with them so that we can arm them with information to share with their consumers, their clients. And so we have a long list of businesses, small businesses that we usually do outreach through. And so it would be sharing information with them that they can then share with their clients. And we're talking about the not just the Fiesta, but we're talking about La Mexicana, the Michoacana, small convenience stores in targeted areas. And Gloria, I'm happy to reach out to you personally as well so that we can continue the conversation.
Yes, sir, to the extent that I can help, I'm certainly willing to, but I think you should also include the Hispanic Contractors of America.
Definitely. Yeah,
we are.
Thank you. We're having conversations with them. Thank you.
And I do want to go back to because you've asked the question again. I just want to make sure that we've made it clear concerning the redevelopment of the Brackenridge campus. I think just 2 points, and Mike or Lisa could weigh in, or Monica, but first of all, it's not an either or, so we're not taking the money away from healthcare delivery or COVID response to redevelop the Brackenridge campus, but then just emphasizing that funding from the redevelopment is going to pay for healthcare services. So I don't know, Mike, if you want to add on to that, but I just want to make sure this isn't a trade-off or an either or, that we can't do both at the same time.
Yes, I think that's an excellent way to put it. It's not a trade-off. This is something that the board has been planning on for a number of years, and we're going to progress thoughtfully and methodically through this process. There's a lot around the Brackenridge development that is dependent upon various city approvals over the next few months, and so there's, like Ted said, it's not a trade-off, but this has been in the making for some time, and it is absolutely critical, the long-term financial strategy, to give us another means to pay for healthcare expansion, service expansion, in different and innovative ways to be able to deliver care. So this is very much a long-term endeavor for us.
Do we have any other questions? I see a question about how are our outreach workers working with community social service partners and who respond to basic needs. And again, we can tag team this response as well. But we've been working with many different social service partners. Also, I want to make sure that we're clear that we're part of the Austin Travis County EOC. And so we are working with the local public health and emergency responders. But one thing Central Health did with the help of our partners, we couldn't do it without them, is we put together one-pagers for each of our priority areas that explained how to connect to resources regarding food, healthcare, transportation, and all of those materials are available on our website in English and Spanish. And we also know that we can continue to update those and continue to broaden that resource list. But I just wanted to reiterate that we are doing that, and we know we can do more, and we will continue to do more. And I'm seeing a couple of questions. Michelle Roundtree has a question. Michelle, can you unmute? Hi, Michelle, we can hear you. We can hear you. Go ahead and ask your question. Michelle, can you hear us? I think we can hear you. I'm not sure. Michelle, I think you're unmuted. If you want to ask your question, it appears you're unmuted based on your screenshot. Okay. I think we could move on. Is there anything else that we didn't touch on, or anyone would like to I had a question from earlier, and I keep, Monica, going back to you, but I think the strategic priorities are so important. But you mentioned the system-based planning approach, and I was just curious if you could explain to our participants how it's different than perhaps how we've planned in previous years.
Sure. And taking a systems-based planning approach really is an approach that it's based on benchmarks. It's an approach that allows us to look across the whole system and take benchmarks from other places in Texas, across the country, where systems are highly functioning, identify models that work and attributes that, we agree collectively that with our partners in the community that will work in our system. And then as we've identified gaps and disparities in our system, we work to prioritize how we will address these gaps. And this is as the work in Eastern Travis County, in Southeast Travis County, and Colony Park, and Hornsby Bend, that is all continuing. But this is allowing us to look across our entire system so that we can plan and prioritize. And we believe that we'll be able to more efficiently and effectively address healthcare disparities by planning across the entire system instead of taking things on one issue at a time, kind of based upon what's on fire. So we can be more strategic in the approach.
Gotcha. I want to make sure that people that are on the call and have been able to join us for this conversation have a chance to ask questions. So if you would like to either raise your hand to unmute yourself or ask in the chat, we would like to answer your questions. So I want to give it a second here, and thank you for your patience with our use of technology. This is one of our few first community conversations using the Zoom technology, and so we do appreciate your patience. We are learning some things, or at least fine-tuning some things as we go, so thank you very much. Does anybody else have any questions that's joining us from the phone or chatting? You would just need to press *6 to unmute, I believe.
I believe it's *69, Ted.
Mine was *6, but I trust you. You know more than I do. Okay, so why don't we begin to wrap up? I know it's 6:45, and this wasn't planned, so my colleagues may do a virtual slap after this meeting is over with, but I would just like to ask everybody if you could just wrap up your portion of the presentation, just one or two takeaways that you would like the folks that joined us this evening to walk away with, and we can just go in order. Mike, if you would like to start, and then we'll go Monica, Lisa, and then Yvonne, wrapping up with you concerning our public engagement process.
Certainly. Well, again, I want to thank everybody for joining us. And again, as you think about Central Health as the healthcare district and how we provide care for over 1 in 7 of Travis County residents, we do this through paying for healthcare through coverage programs, but we also provide access to a very robust health systems. And as Ms. Crowley had pointed out, moving towards a systems-based approach that really tries to think about this in a much more holistic and strategic and thoughtful way. But also thinking about health equity. And as we're working on these different financing programs and these different care and service level programs, how do we bring about health equity for people? However that you may present or see yourself, and that's what's important to us. So please stay involved in this process. And again, thank you all for bearing with us as we move through this virtual meeting environment.
Thank you, Mike. Monica, would you like to hit home on 2 or 3 points that you discussed earlier regarding our strategic priorities and the possible impact of this coronavirus pandemic?
Yes, thanks, Ted. And Mike, one of the things that I really want people to know is that this is just the first of many presentations that we'll be doing on our strategic priorities, and that we have learned and are learning from having to pivot and take on different operations and different ways of supporting both our healthcare provider partners and the communities that we've served in response to the COVID-19 pandemic. And I think it's really important as we continue to work on and fulfill the work that we began in some of our current priority areas, that work is important, that we also need to take on this work to translate what we're learning about how to care, about how we can provide more access to care, and about how we can work to address some of the disparities that are highlighted during this COVID pandemic time, that we're going to take these learnings into the summer and into this coming year as we take this more strategic approach that we believe will improve quality, that will help us address inequities and build equity in a more efficient, more effective, and more satisfactory manner as we move into the coming year.
Thanks, Monica. Lisa, do you want to wrap up the budget piece of this and possible impacts of COVID-19?
Well, I think a couple takeaways I would just share is that everyone, all of my colleagues and everyone on the call, thank you, please stay safe. And that one of our main focus, if not our main focus in the upcoming months, will be to protect the frontline workers and ensure that we are responding to the healthcare needs of the community as quickly as we can. And that is, we've worked in healthcare. It has a lot of uncertainty and risk. And so my second would just be, please follow along. As I mentioned, centralhealth.net, our finance page, we'll be getting our budget page up. Please attend our meetings and share feedback through the information, the tools that Yvonne mentioned. But also know that we will most likely be going through this process with a lot of unknowns and a lot of changes, and we'll just try to roll with it as we go. But I think as we go into this budget season, we will try to keep up. We will keep up with the information as best we can, but we will have a lot of uncertainty and risk, and that will cause us to be focused on the direct services that we need to provide to respond to COVID-19.
Thank you, Lisa. And Yvonne, why don't you wrap this up for us and close this out? But just again, if you could just give people an update on the timeline so they know what to expect.
Thank you, Ted. Yes, thanks everyone for joining this evening. And we are committed to ensuring the public can join us throughout this entire process, much like any other year. Even during a pandemic, we want to make sure that residents with no access to internet can also have access to this information. And so we're utilizing the same strategies that we're utilizing for other things such as education around the pandemic and around COVID to share information about this process. So budget engagement in terms of an online survey, it'll be May 29th through June 21st. And we will put together a budget engagement survey that will then be shared with our board July 8th, and it'll be posted on our website. Like Lisa mentioned earlier, there will be a portion of our website dedicated to budget and budget engagement. It'll have this conversation on there, this presentation, the handout that was shared with you all. And then, of course, we'll have a community conversation to share the proposed budget with the community on August 31st before the public hearing, September 9th and September 16th. So we appreciate everyone joining us this evening. We look for an email from us, a follow-up email with all this information and the information that I mentioned just a few seconds ago. With Ted, is that it?
That's it. Yes. Thank you so much, everybody, for participating, and we look forward to continuing the conversation.
Have a good evening, everyone.
Thank you all.